The TAMHO mission is to serve its members, promote the advancement of effective behavioral health services, and advocate for people in need of care. To achieve this mission, the TAMHO Board of Directors formulates an agenda each year that is designed to improve the effectiveness of treatment and support services for people with mental illness and to increase access to these services throughout the state. Mental illness and addiction hurt. They hurt not only the patient, but also their loved ones, family, and friends, especially if left untreated. Without care, many of these individuals will be left to face the loss of their relationships, jobs, income, and home. The American psychiatric community recognizes more than 300 different manifestations of mental illness and addiction disorders. Thanks to community-based behavioral health organizations throughout the state and a trade association bringing them together, help and assistance to recover from mental illness and addiction has never been far away. For 60 years, the Tennessee Association of Mental Health Organizations, TAMHO, has been bringing together community-based providers of behavioral health services and policymakers to assist local communities in providing evidence-based treatment, state-of-the-art services, and the most effective medicines available to help hundreds of thousands of Tennesseans in reclaiming their lives. That's what Keeping the Promise is all about. With its core membership of community mental health centers and affiliate provider corporations, TAMHO keeps the promise of local, quality behavioral health care through a network of more than 1,000 professionals who volunteer service on committees and task forces and participate in training that addresses current problems and issues. Working together in times of both new opportunities and fiscal challenges, TAMHO member organizations have kept the promise of uncompromised quality care in a healthcare environment that is constantly in a state of change. Together, they have helped Tennesseans access care and take control of their recovery from mental illnesses and addictions that affect their daily lives. Keeping this promise for 60 years, TAMHO has successfully advocated for community-based care for persons with mental illnesses and addiction disorders. Advocacy has been driven by the knowledge that access to high-quality services rendered by caring and talented professionals in local communities is the best front line in assuring that serious mental health problems experienced by 1 in every 5 Tennesseans are treated effectively. TAMHO has worked tirelessly over the years to educate policymakers about the need to provide adequate funding and program flexibility to offer individualized and effective behavioral health interventions that are required to meet the needs of all Tennesseans. Throughout the past 6 decades of structural and operational challenges, TAMHO has kept the promise of providing quality and effective behavioral health services in the least restrictive setting possible. This organization has stayed true to its founding principles regardless of the barriers and challenges. At the heart of TAMHO's member organizations and their more than 6,000 individual care providers and other employees, the values of 60 years ago remain the same: caring for those who need help the most and providing them with the best care available based on evidence and science. Keeping this promise is ultimately about maintaining a quality of care that can be found in every county and city across the state. The promise is that no matter the severity of the mental illness or the complexity of the addiction, those persons experiencing problems as a result of their disease will not have to travel far from home to get the treatment and community support they need to live a full and productive life. Before the creation of the Tennessee Association of Mental Health Centers, or TAMHC, in 1958, there was a long period of time in our country where those persons diagnosed with serious mental illnesses were viewed as embarrassments and were often hidden away in asylums and institutions, sometimes for their entire lives. Beginning with reforms initiated by a visit to the state from American social reformer Dorothea Dix in 1847, through gradual advancements into the mid-20th century, attitudes about mental illness progressed, gradually recognizing the severity of mental illness and the need for better treatment. One of the most defining moments for mental health advocates in Tennessee came in 1953, when Governor Frank G. Clement created the State Department of Mental Health. The separation of mental health from the Department of Corrections was a major victory and ushered in an era of increased public awareness about mental illness across the state. At the time when the new department was created, there were 3 existing state hospitals for those with mental illness: Eastern, Western, and Central State. Subsequently, Moccasin Bend in Chattanooga was opened in 1961. The Tennessee Psychiatric Hospital and Institute in Memphis was opened in 1962. These 5 state hospitals were essentially the only treatment option for serious psychiatric conditions before today's community-based behavioral health provider system was created. By 1959, there were 13 outpatient-based community mental health centers in Tennessee, a development that meant that 89% of the state's population was within 40 miles of such a facility. A bold and new approach at the federal level accelerated the growth of community mental health centers. In 1963, President John F. Kennedy provided the leadership for the passage of Public Law 88-164, legislation that provided federal funding for communities to build and initially staff their own mental health centers. This important legislation gave control to local communities, and they worked with the Department of Mental Health to implement a plan for providing comprehensive mental health and alcohol and drug abuse treatment for designated catchment areas. By the early 1970s, there were 33 not-for-profit community mental health centers in the state that enjoyed wide public support, since they each represented a way to address the unique mental health needs of a given community, and whose boards were comprised of local community leaders. The addition of the Medicaid clinic option to the state plan in 1975 provided an influx of federal dollars to the community mental health centers in support of outpatient psychiatric services. TAMHO member organizations serve adults and children with a range of emotional disorders, mental illnesses, and addiction disorders. With the implementation of Tennessee HealthLink in 2016, most TAMHO members also coordinate physical care as well as provide interventions for mental illness or addictions. As Tennessee's trade association for behavioral health care providers, TAMHO promises to protect and preserve the capability of its member organizations in order to effectively provide a comprehensive program of high-quality, professionally administered behavioral health services to all persons in need of care. These promises include serving as a forum for the sharing and exchange of information, ideas, and solutions, influencing public policy and representing the membership perspective to key decision-makers, educating and training membership staff, community professionals, consumers, families, and other stakeholders, improving public awareness and understanding of behavioral health care issues, advocating for people in need of mental health and/or addiction services, recognizing and honoring individuals and organizations who contribute to the advancement of behavioral health care, and developing and sharing products which positively impact the behavioral health care system and improve clinical care outcomes. If you know the beautiful state of Tennessee, then you know that its geography is as diverse as its residents. When not able to be there in person, TAMHO member organizations tap technology to deliver more than 12,000 behavioral health care services via televideo communications on an annual basis. TAMHO member agencies provide behavioral health services in more than 600 service locations and hundreds of public schools in Tennessee's 95 counties. Legislative, education, and advocacy are integral parts of TAMHO's public policy efforts. Over the years, TAMHO has developed strong relationships with public policymakers on the local, state, and federal levels. These relationships provided education and developed numerous behavioral health champions. TAMHO members have found that they're the most successful when they speak with a common voice. TAMHO's annual Advocacy Day offers an opportunity for staff of TAMHO member organizations to use that voice as they meet state policy leaders and advocate for legislation that is important to their clients and the profession. That voice is also used on the national level at the National Council for Behavioral Health's annual Day on the Hill. In addition to impacting the field of behavioral health services, serving its members is an integral part of the TAMHO mission. One cannot count the number of lives impacted by TAMHO over the past 60 years, but a few of its members have recently shared their experiences with us. TAMHO staff anchor the association activities and coordinate internal work groups, communities, and task forces to ensure members have the best information available to help them assist their clients. They work with various state and community partners to educate and advocate on behalf of the association. TAMHO staff have also represented the association in the acceptance of numerous state and national awards. As in years past, a highlight of our year-end event is the TAMHO Awards and Recognition Ceremony. This event allows the association an opportunity to recognize those who have made a real difference in the lives of others through their leadership in personal recovery, advocacy, media, direct service provision, or management. TAMHO has become known as the source for behavioral health education in Tennessee by providing an array of professional development opportunities for the behavioral health community. Internal training events are designed specifically to respond to TAMHO member needs. Trainings for broader audiences are often conducted in partnership with state departments, other associations, and advocacy groups. Attendance at these events average approximately 225 people, with an overall annual attendance of approximately 1,200 people. We thank you for the part that you have played in TAMHO's success as we celebrate its 60-year anniversary. May TAMHO always keep the promise so that no matter the severity of the mental illness or complexity of the addiction, individuals experiencing problems as a result of their disease will not have to travel far to access the treatment and support they need to live a full, productive, and satisfying life.